dive into today's presentation, which is on the SDPI outcome system, baseline data for 2020. As I go into this, and if you have any questions, feel free to enter them into the box to the left. I have several folks with me on today's webinar that will be collecting your questions, and we will go through some questions after the presentation portion, and if time allows, we'll go into a demonstration of the SOS as well. So we're going to start by just going over a recap of the requirements, and then going into the data submission, the process methods, and data review for submitting your 2020 baseline required key measure data. As I said, we'll pause for some questions, and if time allows, we'll go into a website demonstration. And then I also have some reminders of some other items that are due, including your 2019 final required key measure data and your 2019 annual progress report. I have some abbreviations that are here. As you know, we use quite a few abbreviations, so if you need for reference, that's available in the handout that's above in the upper left-hand corner. So let's go into the required key measure data for 2020. So just a recap of the requirements for SDPI grantees. All grantees are required to select one best practice. We have about 19 available. They were to describe those activities and services for that selected best practice, and then describe and determine their target group size. All this information is provided in that 2020 project narrative that you submitted with your application. And you can retrieve that if you ever need in Grant Solutions. Look into your grant history, and you should be able to download and look at your 2020 application, including your project narrative. So in terms of the data requirements for this grant, there are two main data points that are required each year. One is your baseline, which we'll be talking about today. There's a mid-year that we encourage you to submit, but it is optional. And then there is a final. So in general, we look for two data points throughout the year for your data requirements for SDPI. In terms of guidance, you want to select the best practice that addresses needs identified in your community. And anything that you can move the needle on, you can show improvement on using the required key measure data. So why do grantees have to submit the required key measure data into the SOS? The main goal is to show national results of SDPI activities. We have lots of data from the National Data Warehouse, from the audit, but we wanted to find a way to have the data that showed results directly from SDPI, and that is the goal of the SOS. One question that is commonly asked is if improvements are being made, and if so, how big are those improvements, and how many people are receiving the best practice related activities and services. The SOS also allows you to show stakeholders the good work that's being done. Keep in mind that you can share your program's results with your tribal leaders, community members, and others. The Division of Diabetes will also usually provide required key measure data with IHS leadership, tribal leaders, and others. So for the required key measure data, the result is the number and percent of target group members who achieve the required key measure. But what is the required key measure? Well, it's specific to each best practice. So I can't answer that simply, but if you look at your best practice that you selected, you will see your specific required key measure there. I have two examples on this slide for your reference. One is from the diabetes-related education. That required key measure, if you selected that best practice, is the number and percent of individuals in your target group who receive education on any diabetes topic, either in a group or individual setting. And this can include nutrition education, physical activity education, any other diabetes-related education. That's a lot of detail for the required key measure. We have another example that's clinic-based, glycemic control. The required key measure for that one is number and percent of individuals in your target group with the most recent A1C less than 8. The required key measure data is tracked locally through the budget period. calendar year, and it's submitted to the Division of Diabetes through the SOS or SDPI outcome system at the beginning and at the end of the budget period. Data can be submitted multiple times, but in terms of the grant requirements, that is all that we're asking for. On the next slide here, I have a table that just kind of highlights the different data points that you can be submitting throughout the year. And we're going to focus mostly on the baseline, though, but I'll kind of go through the rest as well. In terms of baseline, though, that is a required data that needs to be submitted. It reflects your starting point. And I'm going to go ahead and see if I can utilize my arrow here. Oh, maybe not. It's due at the end of February. So we usually have final data for the previous year due at the end of January, and we have the final or the baseline data due at the end of February. And that's kind of the general guidance. Usually we try to make sure that the due date is on a Friday so that, we don't have the data due on some sort of weekend. So that's why we went with the 28th here, and you'll see as you go down the line that some of the dates aren't exactly at the end of the month, but they're at the end of a weekday in the month. For baseline value, it could be 0% or higher. And in many cases, especially for those that selected an education best practice, their baseline will be 0%. Mid-year, again, is not required, but we encourage it, especially if you have the capability and if you have updated data. It's a great time to do it. Usually we encourage it about the time you're working on your application. It gives you a better insight of what you've done so far in the year to see how you want to progress for the next year. And as it states here, the mid-year reflects progress so far. So based on your best practice, how are you doing on collecting required key measure for that best practice? And again, it's just sometime around the middle of the budget period. So the due date isn't really set in stone. It's really just sometime in the middle of the year. And usually with applications are due sometime in September for continuation. That'll usually be a time where I encourage grantees even then to submit some sort of data so they can see progress made so far. The value, the general goal is to have it usually higher than 0%. I know in some cases it might be lower than what somebody's baseline is if they knew who the baseline information on their target group, and that's okay as long as you're seeing progress being made. Final data is required as well, and that reflects your final results. That's usually collected towards the end of the budget period. We allocate an extra month after the end of the budget period for you to submit that data, and that's why the data is due at the end of January when your budget period end date is 12/31. The value could be up to 100% or higher. Not necessarily bad if it's less than 100%. Again, the main goal is showing improvement. And then the final is that time of the year where you get to lock your data. We have lots of people that like to lock throughout the year, and that's okay though too. We'll help you unlock your data, but the final is when you truly, we do encourage you to lock your data so that you can move on to the next year. I have another table here that just kind of highlights some of the required key measure data sources. So there's two sources mainly that you can submit your data, and one is from the RPMS or another EHR. You would begin by setting up your target group list using a register or a template, and it may be different from your diabetes registry. When you're using RPMS or EHR, your target group list is going to be uploaded and stored into the web audit, as well as your target group data for your target group members. That will be in the web audit as well. When it comes to submitting your baseline results into using RPMS and EHR, you have two options. One is to create an audit data file for your target group using the beginning of the year to the end of the year of the previous year, and you're going to upload that into the web audit and pull into the SOS. The other option is to do an aggregate, and that's generally for education best practices. It may also be helpful for maybe somebody who who decides to go to do individual entry and just wants to see, have documentation of data that was provided in the previous year. Final RKM result, for that, the RPMS or EHR, folks would create an audit file for the target group for the year of the budget period that they worked in and upload the data into the web audit and then pull into the SOS. Now, in terms of other sources, if you're using another source other than RPMS or EHR, you can keep track using Excel, paper, whatever method you have on hand. Your target group list will be entered into the SOS as well as the required key measure information for those members. And you'll see more of that when we go into the demonstration. There's two options for the other method. One is individual entry, and the other is aggregate. Now, considering that we're talking about baseline today, it is generally okay and even sometimes appropriate for you to use aggregate for your baseline. However, when it comes to final data submission, we want to make sure that you're using the individual entry method so that the source is the SOS for your data. And then for the final result, submit into the SOS using that individual entry. So for the 2020 best practice and target group information from your program, you wanted to start by reviewing your 2020 project narrative, as I mentioned before. Again, that can be accessed in Grant Solutions in your grant history. You want to note your best practice that was selected and your target group information, the number and description, because that'll be your starting point for entering your information into the SOS. Determine which method your program will use to track the required key measure data and submit into the SOS for 2020. So again, if you're using RPMS or other EHR, you're going to upload into the web audit and pull into the SOS. Any other data source, you may be entering aggregate or individual information into the SOS. And so whether you're entering aggregate or individual may determine maybe due to whether you know your target group or not know. So if you know your target group at baseline, you would most likely go with individual entry for entering in that information. If you don't know your baseline, that's okay as well. You can add as you go. And that's generally accepted as well for the education best practices. Even for those that may not know their baseline, this can also apply for people that selected those who are newly diagnosed with diabetes. So that might be another example where you may not know the care that was provided to somebody because they weren't diagnosed with diabetes the year before. So let's go into data submission, the process methods, and data review. So starting with an overview of the steps for collecting and submitting your required key measure data. First off, you need to make sure that you have access to the SOS. So I know that's not a big number of you, but for that small number of you, if you don't have access, you'll want to make sure that you set up your account and request access. So it's like two small steps. One will be registering for an account into the IHS web account system, and then requesting access to the SOS. And I'll show those on the demonstration. You'll then need to set up your target group, and your target group can be set up as a list to track your target group. You can add members when you know who they are, and then collect required key measure data for your target group members. You can enter in your best practice and target group information into the SOS. And again, that's where you can also use your project narrative as guidance or a reference. For your required key measure data, you're going to gather locally or from your RPMS or other EHR, and then you'll be submitting into the SOS. So in terms of SOS access, the place to visit is the SDPI website. If you go to the SDPI website, go into the SOS, and there is a tab there for you to request access to the SOS. As I mentioned earlier, you need to create an IHS web account, which is mainly a username and a password. And you'll use that to log into the computer and log into the SOS and request access. Now, if you're not sure if you vaguely recall being in the SOS before and not sure, you can always contact the SDPI team. Our email is sdpi@ihs.gov, and we can let you know if you have access, and if you do, what your username is. From there, you can go through the steps to reset your password. There's a link in the sign-in to that's stated forgot password, and you can use that to change your password. More than one person can have access to the SOS for a program, and we do encourage that. We don't encourage sharing of usernames and passwords. So if you feel that it's helpful to have more than one individual to have SOS access for your program, we encourage them to get their own username and password and submit a request to access the SOS. So some other guidance I wanted to provide on this slide as well is at this time of the year, the SOS access, I get lots of requests at this time, and maybe it be due to turnover or just new people getting into the system. I wanted to add in some additional guidance as well. So it always helps when you do create an IHS web account to use a work-related email to create your account. If you use a general account, we usually reach out to you and see if you have a work-related email account that you could use. It's just preferred. Another thing too is sometimes you get new people that are asking, and what I use for the SOS to check to see if I should approve access for somebody is I use their latest application. So if I don't see your name there, I might be reaching out to other individuals with your program to see if it's appropriate for you to have access. So if it helps you to get access sooner rather than later, it may help to have somebody in your program send an email to that SDPI@ihs.gov to introduce you as a new person with the program, or if there's no one available, you can introduce yourself as well using that SDPI@ihs.gov email. I also want to note that the Web Audit Access has their own setup in place too for granting access as well. So always helps to keep an eye on your email after you submit your request to see if there's any follow-up questions. So let's talk about selecting the target group members. The target group is the largest number of patients or participants that you can realistically include in the activities or services for your selected best practice. Going back to that project narrative again, that document provides a lot of steps and questions that you went through in order to select your target group. So that's something to keep in mind as well, and to reference as you're putting in your target group information. So for those of you that know your target group members at baseline, you want to determine your target group members on or around the beginning of the year, so basically this time of the year. Follow the same target group members throughout the entire budget period, and that's basically throughout the entire calendar year. Your goal is to not add any new members. You want to create that group early on and stick with that group throughout the year. You also want to avoid removing members. However, we do understand there may be special circumstances to remove individuals such as death or a relocation. So going through an example, the best practice is glycemic control. A grantee identifies diabetes patients with the most recent A1C greater than 9 and selects those for whom A1C less than 8 is an appropriate goal. If members are not known at baseline, you can add target group members throughout the budget period. So our example here is best practices physical activity education. Grantee is providing community-based education sessions, so they don't know the entire group. They will serve ahead of time. They will add members as they hold education sessions. So especially for those of you that may have selected your target group as those in their community. You may not, you know your community, but you may not know those specific individuals yet. And when it comes to entering individuals into the SOS, we ask questions. The questions we do ask for you to enter an individual are the month of birth, the year of birth, and gender. So having that in mind, if you don't have that much detail on those individuals, then you can probably move forward as with the steps of not knowing your target group at baseline and adding them as you go along, providing your activities and services. So let's talk about pulling in terms of submitting your data, pulling from the web audit. So you're going to start by setting up your target group list in RPMS. If you do know those members, who those members are at the beginning of the budget period, you can add them. If you don't know who those members are, you can add them as you go along into your RPMS system. You'll then create an audit file for your target group. Your baseline is going to be for January 1st through December 31st of 2019. The main reason for this is that you want to see how they did the previous year. By having that information, you know, okay, this is our starting point. We want to do better than this. So whatever number you had, your goal for the year is to make an improvement on that number. If you've reached out and provided an exam to maybe 40 individuals out of 100, your goal for the year of 2020 is to do better than 40. Reach out to more than 40 individuals providing that exam. Your final data will be the year that you've provided these activities and services. So in this case, it would be January 1st through December 31st of 2020. You'll then upload the audit file into the web audit as an interim audit. You'll enter in the best practice and target group information into the SOS and submit your required key measure data into the SOS, and you'll pull into the web audit. And if time allows, I will be able to demonstrate that. There is a possible exception for those who, with this education best practices, we have 3 of them that are available: nutrition education, physical activity education, and diabetes-related education. If you selected those, your baseline, you may be able to use aggregate, and generally we're okay with you starting with a 0%. Overall, my guidance for anybody, if I'm helping them with the SOS, is that if you have the capability to pull from the web audit and you have the information on your target group members from the previous year, then I encourage you to do it. That's my general guidance when I'm helping individuals when they're pulling data from the web audit into the SOS. So some considerations and for RPMS, starting with the requirements. In order to do this method of using RPMS to upload into the web audit and pull into the SOS, you do need access to RPMS or another EHR. You need to have the ability to create a registry or a template of your target group members. And then you'll need timely and accurate entry of data into that, of your required key measure, entry of data for your required key measure into the system. And then, of course, access to the web audit. Some pros about using the RPMS to web audit to SOS system is once target group is set up and data are entered into the EHR, data can be pulled into a data file, and it does not require separate entry data into the SOS. You can use the RPMS and web audit tools, including reports and graphs. So those are the pros of using RPMS. The cons are it's not available if the program does not have access to RPMS, other EHR, and web audit. And then if the data is not accurately entered into RPMS, the RKM data will not be current or correct as well. So going into entering individuals, that's the other way that you can submit information into the SOS. If you more used to using Excel or some other software, I know I have a few grantees throughout the year, they might switch from RPMS to some other electronic health record system. In those cases, individual might be their best bet for the time being. Or even paper to keep track of your data, of your target group and your required key measure. The basic steps are you would start by, again, creating your target group list. And again, if you do know your members at the beginning of the budget period, you can add them. If you don't, you can add them throughout the year. And then you'll enter in the best practice and target group information into the SOS. So again, very similar to the RPMS system. Here's where it gets different though. You'll be entering individual information for each target group member into the SOS. So here's where you'll need that person, every individual's month of birth, year of birth, gender, and then whether or not they met the required key measure. You'll be entering, submitting required key measure data into the target group for each of the target group members. Your baseline may be an individual entry if you know your target group already. It may also be aggregate if the target group is not known. And then your final is to finish entry of individuals in the SOS and be sure it's complete. And then submit the final result into the SOS using the individual entry. So for those that may have other data sources, some requirements are that they'll need a system for tracking their target group and required key measure, an entry of information for each target group member into the SOS. One of the pros is that you don't need access to the EHR in order to do this. You can use whatever system you have in place that works for you. Cons is that you must keep track of the target group members outside of the SOS. Also, no personal identifying information can be entered. So you need some sort of way of keeping track of those individuals so that you can identify them in the SOS. And you must enter data into the SOS in addition to local system. So some reminders for those that choose to use individual entry. As I mentioned, the personal identifiers, names, chart numbers, full dates of birth cannot be entered into the SOS. We only ask for the month of birth, year of birth, and gender. Each individual is assigned a random ID number, and if you look in the SOS, it's called the participant identifier by the SOS. There's no way to connect the SOS ID number with the identifying information about the individual within the SOS. So you want to make sure you have that separate system to identify those individuals. Since your local list will contain those personal identifiers, you want to make sure that you're using whatever local policy you guys have in place to keep that information secure and safe. And then it also helps to let another team member know where that information is stored in case they need to access it as well. We usually encourage to have at least 2 people know where that information is, especially if there's turnover. That's something we hear about a lot. If that happens, is that they can't find where that information is on those target group individuals. So after submitting your data, you want to review your what's been entered so far. My best recommendation for this is to go into the SOS grantee reports on the side menu of the SOS, and if you are able to pull up a report, then that means you have submitted a baseline. You have submitted baseline data. If you are not able to, then that means that baseline has not yet been submitted. So that's one of the best ways to check and see if you have baseline submitted. Some general issues are, though, is the exact same value in there more than once? We usually call those duplicates. If so, let us know, and we'll be happy to remove one of those duplicate values. Also, is the correct value marked as baseline? If you entered in multiple data submissions and want to make sure that the right one is labeled baseline, you can always contact us as well, and we'll be able to fix it. Generally, I see that happen around mid-year, so that's something to keep in mind as well. Around mid-year, that's when I usually am helping people fix their baseline value. All right, so going into the RKM data review, web audit method, one common issue we see sometimes as well is is your denominator very different from your target group number? That might be a case where you just pulled from the wrong report. If there's multiple reports in the web audit, it may be kind of hard to figure out which report you need to pull in. So if so, check that your baseline audit was run on the correct registry list, rerun, and resubmit if necessary. Also helps to name it. A lot of grantees will name their baseline. They'll put baseline into the name when they're creating their report in the web audit. Some individual entry method issues is the number of individuals entered much smaller than your target group? If so, determine if additional individuals need to be entered. Also, if the number of individuals entered is much larger than your target group number, that might be something to look into as well. That might especially happen if you have more than one person entering individuals. So always helps to kind of just keep track of that, and if you have any issues, you can contact your ADC, and or you can also contact the SDPI team at sdpi@ihs.gov. All right, so for baseline required key measure, other considerations, if you're using the web audit method with RPMS, you want to use audit 2019 or 2020 in DMS. Again, you're going to use 12/31/2019 as your audit period end date. So again, you're starting with last year to see what happened last year with your target group. In the web audit, select the year that matches the DMS version. So 2019 for DM19 and 2020 for DM20. Your program can only select required key measure data for your one selected best practice and target group. So that's something to keep in mind. The SOS is very specific to your best practice and the target group for your best practice. Unfortunately, the SOS does not collect any information for any other activities outside of your best practice. Required key measure data can only be submitted for the target group as a whole. It cannot be submitted separately for subgroups. So if you chose, for example, to work with youth as well as elders, you won't be able to separate them into two separate groups. You'll have to put them in all together. Some of you may also be working with other sites. And the other sites might be collecting information when it comes to putting it into the SOS. However, you'll have to submit it as one giant group. So just to emphasize too, and I mentioned this briefly, but not in as much detail as this slide, we just wanted to let you know that your required key measure data will not be shared with anyone other than BDTP, DGM, and ADCs. And your data will not be used to determine whether or not you receive future SDPI funding. This is especially significant as you work on your final data. There may be programs where something happened and they weren't able to achieve an improvement. That's okay. It's all about submitting your data and meeting your grant requirements. So, anything in there is helpful for us. You will not use your data to evaluate your activities and services that are not related to your best practice. You'll make sure to describe your progress in your project narrative and your annual progress report. So in terms of information and resources, first off is the SOS website. There's the link for it there. And then we do have checklists as well. I don't have checklists available quite yet for the baseline, but my goal is to get baseline checklists out and available by early February. And then we do have recorded webinars on the training page. The final data submission recording is available on that page as well as the SDPI training webpage. In terms of other resources, just the general SDPI website, the SOS lives there. The audit website lives on the Division of Diabetes website, and there's a link for it there. And then we also have a link for RPMS. So if you're having any questions or issues on RPMS, you can visit that site and see what guidance they can provide there as well. So with that, I'm going to go ahead and answer a few questions, and I think we're doing good on time, so we should be able to do a demonstration as well. So first question is from Brad. Can I create a spreadsheet of some sort for the audit data file and upload it, or is there one that I can use? Karen, if you don't mind, I'll have you answer that question.
Sure thing. So a spreadsheet of some sort won't work. It actually has to be a data file in the very specific data format that's required by the web audit. So usually those files are created by RPMS or in some cases other electronic health record systems, but it's not really something that you can just create using Excel. It's something you'll want to extract the data from your system, and if that's not available to you, then you'll need to enter your data into the SOS individually.
All right, next question is from Olawan. What are the keys for RPMS needed? Would you know a response for that one?
I don't. I'm not an RPMS expert. That is something that you need to talk to the clinical applications coordinator probably at any particular facility. I think they're sort of common across facilities, but really for the facility that you're looking at, you'll need to contact them to set you up with the appropriate keys. And I believe there may be documentation in the Diabetes Management System manual on that as well.
All right, next question is from Ysleta. Why is the baseline from January 1st through December 31st, 2019? So the reason for that is it gives you an idea of what happened last year. It gives you a full year's worth of data, and it tells you what happened in the previous year, so that as you provide your activities and service in the current year, when it comes to you submitting your final data, you can compare what you did for your required key measure for the year that we're in now versus the previous year. Hopefully that explains it. Karen, if you have any other thoughts on explaining that.
Yeah, I think there has been some confusion about this. So again, the idea is to show improvement. And so in particular, if you have a target group that you're identifying at the beginning of the year, generally, but not only for clinical type best practices, then you do want to kind of see how you did last year compared to this year. For the education best practices, again, you often don't know who those people are going to be, and so that's why your baseline might be different in that case. Hopefully that helps.
Question from Amanda. Are we able to pull from web audit and still enter individual data? I have seen that. The best case scenario where I've seen that is where somebody had RPMS at the beginning of the year, and then throughout the year they switched to another system, and then they've done individual for the final because the new system, they didn't have time to set up the new system in order to submit information into the web audit. That's the common scenario I see in which that happens. Another common scenario is somebody who is more savvy with RPMS and web audit submitted their baseline that way, and then there was turnover and the new person was still learning the ropes, and it was easier for them to submit final data. So those are the two cases where I've seen that. So overall, though, it is possible. It usually just depends on the program and the situation they're in. Karen, can you think of any other reasons why or scenarios?
So just to clarify, what was sort of implicit in what Melanie said is you have to choose one method for baseline and one method for final. You can't mix the methods. You can't use some web audit and some individual for baseline. So you have to pick one method for your baseline, one method for your final. So you could use web audit for baseline and switch to individual for your final, or vice versa, but you can't mix methods for baseline or for final. It has to be pick one.
Thank you for that clarification, Karen.
Mm-hmm.
Next question is from Sydney. So we have not received any notifications for this webinar. Will this be like this going forth? Reach out to me. My email is sdpi@ihs.gov, and I can check and see if you're having any email issues. We do send lots of notifications out via email, but I know that sometimes there may be email security features in place, and you might have to work with your local IT in order to get those security features so that you can receive notifications from us.
And I did just quickly check our list, and Sydney, you were on the email list for even the reminder for today's webinar, which does suggest that maybe somewhere it's getting caught up in the system. So, but hopefully Melanie, as she said, can assist with that.
Right. I don't know if this is an addition to the question from Kay. We have had Greenway here for about 3 years now. We have not been able to electronically enter into the SOS or the web audit with this program. If anyone else has had success with this, let us know. Greenway sounds like a new EHR system to me. Karen, do you have any experience of anybody having success with that?
So I think that was a follow-on to Sydney's other question, which was about moving to Greenway from RPMS. And so the web audit can accept data from different EHRs. It's really platform independent. The issue is your system has to be able to create the data file, again, in the exact format that's required by the web audit. You know, computers are really black and white. They can't accept some of this and some of that. It's got to be in exactly the right format, every single field. It's really quite a complicated process. So it is certainly possible, but it does take a lot of time and effort and coordination among the clinical team, the OIT folks, and anyone else who's sort of involved with that process. So I've heard of Greenway. I don't know that anybody has successfully submitted into the web audit using that system. I'm pretty sure no one has in recent years. It can be helpful to sort of find the folks that are using that same system out in the field. So maybe, Kay, you want to connect with Sydney, and you might be able to provide each other with some support. We do our best to support people in getting data into our system, but we really can't answer any specific questions about systems other than RPMS.
Thanks. I'm sorry for missing Sydney's question there. But thank you for connecting that. All right, next question is from Elizabeth. Once the data is submitted for baseline, is there a way to go in and update it? I can hit edit button, but it does not let me edit if the answer was a yes or a no. You should be able to, but if you have any issues, give me an email, shoot me an email, sdpi@ihs.gov, and I can help you with the details and see if you come across any issues that we need to fix. Next question is from Vonda. I've researched and cannot find the information on how we choose patients for the audit. Is it a percentage? Karen, would you mind answering Vonda's question?
Sure, and I'm sorry you've had trouble finding that information. So it actually can be found on the audit website. If you drill down to the resources page, and then there's a document called the Audit 2020 Instructions that will provide you guidance for selecting patients for the audit. If you are using your electronic health record system, whether it's RPMS or something else, to conduct your audit, generally you want to audit all of the patients with diabetes that you have that meet some very broad eligibility criteria. So you really want to cast a wide net if you're using your EHR. If you are conducting a manual audit for whatever reason, we still have a number of sites that do that, then the instructions do include information for what number of patients you need to audit and how to select those patients randomly. So Vonda, I hope that's helpful, and if you can't find them, you should feel free to reach out to the audit team and we'll help you out.
Thank you. Next question from Yvette. We are using Activate DMS, I don't know if I'm saying that right, as our baseline. We are not a large tribe, so our number of DMs is reasonable. If we gain more active DMs from either new diagnosis or new to the tribe, can we include them? So that was something I covered earlier. We generally don't recommend that you include individuals throughout the year, especially if you've entered in your target group and you know your target group. We encourage you to stick with that target group throughout the year. Now, if you're doing something where you're adding members throughout the year, you don't know who your target group is, then in that case, you should be fine. But based on what I see here, it looks like you do know, so I would recommend that you just stick with the group that you've pre-selected.
And just to add on to that, Mel, that doesn't mean you can't include those people in any of your SDPI activities or the services you're providing. You absolutely can serve them. It's just you wouldn't be reporting them in your target group with your RKM for this year. Just we're trying to kind of keep that data a little bit cleaner, but you can absolutely still include those folks in your program.
Good point. Next question is from Christy. I have been using individual entry for our SOS. Entering them is very tedious. It kicks me out after each individual's information. Then I have to select individual entry again. Is there a way to avoid this? I've never come across that where you're kicked out, and I'm sorry to hear that. We are working on moving the SOS into a newer, I guess, web format, for lack of a better word. Hopefully that will take care of the issue. As soon as we have more information on that change, we'll keep you all updated, but I'm hopeful that that will help you so that if when you do enter individuals, once we move to the new formatting system, it'll be a much easier process. Next question is from Candy. For my RKM on statins, should my list of people on statins for December 31st, 2019 be the same list I ran in February of last year? We have a new AHR Greenway, so this is my first year running statin use on Greenway. I don't know if this might be one for you, Karen, or if we should have Dr. Bullock answer this one.
Well, I'll start it off maybe. So something from February of last year would not be anything that you would use for your final data for 2019 or your baseline for 2020. So I just want to start with that. And so it really just depends on, what is your target group for last year, what is your target group for this year, and making sure that you get the appropriate data for that. Dr. Bullock, do you have anything to add?
Hi, everyone. It's Ann. I absolutely agree with that. And really, it's sometimes people want to shift groups, like you've done a great job getting everybody on a statin who needs to be on one, and you want to use a different group. As you heard earlier, you can change target groups. But if you want to keep working with the same group to make sure that you are keeping everyone on statins that should be on them and adding even more, you can use the same group. So hopefully all of that was helpful. Thanks.
Thank you. Next question is from Darlene. So what if you chose nutrition education for best practice, but your program did really good and only a few new DMs did not get nutrition education in 2019? Do you just put 0 as baseline because none has received nutrition education in 2020? Please advise. So in general, one of the slides I mentioned was talking about you want to select a best practice that you can make an improvement on. Considering you have that information, it sounds like you selected a best practice that you already do well at. So might be something to consider for next year. But in general, though, we've also mentioned that for education best practices, you can put 0. So that's a possibility as well. So just some things to think about. Karen, is there anything else you can think of to add on to that?
No, again, the education best practices are a little bit different, and so, I guess we sort of presume that if you're doing education and you want to work with the same patients, you're going to be providing them sort of with different education this year on different topics, and so it is okay to put a 0 baseline for education pretty much any time.
All right, next question is from Shayla. I know baseline is due by 2/28. However, are we able to submit it now if it's ready? Yes, you are, because 2020 has gone live. So when you log in, 2020 will now be the default year when you log into the SOS, so you can submit your baseline data anytime now. Next question is from Kat. Where do you get the correct format requirement to upload the data if you are using a different EHR like Greenway? I think, Karen, you'll do a better job of explaining where to find that if you don't mind.
Right, so the very specific format requirements can actually be found in that same audit instructions document that I mentioned earlier. So if you go to the audit website, find your way to the resources page, and then I think it's the first or second link on the page is Audit 2020 Instructions, and then you'll look in one of the appendices for that. We also have a webinar that was recorded back in November that provides an overview of the process for preparing your EHR to conduct an audit. That was recorded and has some additional resources. So definitely recommend that you contact the audit team to request that information. It's not posted on our website. It's not 5-weight compliant, and it's not something that's for a larger audience, but it's available on request from anybody who needs it. So if you could contact the audit team, and I'll put the audit team email address into the questions box, and Lucy's already put the audit website in there as well.
Great. Next question is from Rose. Is final data due on January 31st? Yes, that's when the final data is due. So if you have any questions as you're working on your data submission, again, you can contact the SDPI team at sdpi@ihs.gov. Next question is from Amy. It looks like this is a question for you, Dr. Bullock. Can you please update us on SDPI 2020 grant funding?
Sure, absolutely. Glad to, guys. Once again, we're in a year where we're getting our funding a little bit at a time and still don't have the full year's worth. So as I think most of you are aware, but just a recap, so SDPI has so far received 3 partial year funding authorizations for this 2020 budget period. We got the first one right before the new fiscal year on September 30th, a second one on November 21st, and a third one on December 20th. So if you take a look at the dates, because they think about fiscal years, it says that we're authorized through May 22nd, 2020, when really we think about it because our calendar year grant cycles, we think about it as being the amount of money. So we've been so far authorized a total of about, just over $96 million, which is about 64%, a little under 2/3 of our $150 million that we usually receive. So of course our 2020 budget cycle started on January 1st. So all of the NOAs have now been awarded for the 2020 budget year. This is the last year of the current grant cycle, as you guys know. So you all should have received your NOAs, or will be in the next day or so, but they've all been sent now. So everybody should have that. As you guys know, that some of you received 25% of your annual grant award because those were all the funds we had to send. Because that last authorization on December 20th, we still don't have those funds. It takes a while for them to get to us. They have to go through Office of Management and Budget and all kinds of other places. So even though that authorization was signed December 20th, we won't have those funds until the end of January, most likely. At that point, the Division of Grants Management will be looking at ways to help supplement those grants that received 25% of their annual grant amount. For the rest of y'all, you got, some of you had some offsets, had large prior year balances, and so Division of Grants Management did an offset. For those grants, y'all have received the authorization for all of your grant amount for the year, although between 50 and 100% of that grant amount would come from your own carryover that you already have. This is the authorization to use that in 2020. If you received 50 or 75% offset, then you also received new money for 2020 to make up that remainder. So all the NOAs have gone out. Hopefully you've all received them or will within the day or so. And all of the grants have received at least 25%, and if an offset occurred, then have been authorized for the full amount. So it's a lot of information. We're certainly all hopeful that SDPI will have the rest of the year authorized, the remaining roughly a little over 4 months equivalent in funding. But because we have an authorization that goes through May 22nd, we may not have any change in that status until sometime in May. And we'll just have to see what Congress may elect to do at that time. So I know that was a lot of information. Hopefully you're aware of at least most of that. Please let us know if you have questions. As we're thinking about the next grant cycle, Melanie will be talking about this in a minute, but we're already anticipating, even though we don't have full funding for this year, we're already looking to the next grant cycle, which would be a 5-year cycle of 2021 through 2025. So the notice of funding opportunity for that, or NOFO, will hopefully be going out in April or May for that. But to get everybody ready for that, we're going to be putting out a series of webinars to help folks get ready, especially those who weren't with us the last time around in 2015 to get ready for the current grant cycle, or for people who want to review on how all that competitive process works. Please be sure to join those webinars. They're all optional because some of you all have been around the block here and don't need us to remind you of those things, but for others who are new or only went through us maybe once, perhaps some of that will be helpful to you. So our intent is to get absolutely everybody through this process successfully. If we can do that, we will all be very happy because, as you know, the funds are distributed based on a formula. Y'all do not compete against each other. So with that, hopefully I've more than answered your question, but if anyone has any other follow-ups to that, please let us know. Thanks.
Great, thank you. Good segue too, because the next question is about upcoming webinars. A question from Paula: will they be describing the new processes for the that will be describing the new processes? Will they be recorded? Yes, they will. All of these webinars that are coming up, and I'm calling it like a series of webinars to prepare everyone as best we can for the 2021 competitive application process. We will make sure that they're recorded. It will take a while to get the recordings up on the website, but I might be exploring other ways of sending out the recordings ahead of time, possibly via email or some other method as well. So I'm just kind of exploring that right now, but those will be recorded. So one thing you can do in the meantime, though, is just make sure you're on our email list. You can send me an email, sdpi@ihs.gov, and just like we did for a previous question, we can check and see if you're on the email list and getting our emails. Next question, and I know we're running up to the top of the hour, but there's still quite a few questions to go through. So we'll continue to ask questions. I did ask the staff that's here with me if they were okay with me doing a demonstration. I will, once we answer questions, I will do a demonstration for anyone that can stay on. They're welcome to. We are going to have it recorded, though, so the recording of the demonstration will be provided as well. All right, so going into, but for those that do have to get off, just know that we are recording, and the recording will be available as soon as we can get it available onto the website. Next question is from Isleta. Just want to clarify, in the education best practice, do we use the target group from last year as our baseline from this year, or do we start with 0 like last year? It's up to you on what you put on. My general guidance is to look at your project narrative to make sure, like, is it the exact same members? If you're just kind of reaching out to your community, and most of them are, but some of them may not be, overall, it's best to just start with 0. Now, if it helps, though, and sometimes I do recommend this, is you could, if it's pretty much the exact same group of people, you could put it in as an aggregate and then have it as a note for yourself to try to make an improvement on top of that. But if there's new individuals involved, in general, I recommend to start with a 0 baseline. I hope that helps. Next question is from Kay. After you enter your RKM target group individuals, if some of these individuals move or are no longer getting care at our clinic, should they be taken out of the target group? Our general guidance is due to the patient passing or relocation. If they move, I guess that makes sense to go ahead and remove them. And no longer getting care, usually that's generally acceptable as well. In general, it's kind of based on like how your system removes individuals. If you're using some sort of electronic health record system, that's kind of where we base our guidance on. In your case, though, both those examples look acceptable. Question from Randy. Do we have a target date for the updated taxonomies for the web audit? Karen?
I am happy to report that updated taxonomies for the web audit are available on the audit website now. So on that same audit resources page, if you look into the second section, there's some RPMS lists there, and they are from RPMS, and they include all of the taxonomy information for the site populated taxonomies. So Randy, if you have any problems finding those or any questions, let us know. I've been meaning to mention too, with all these audit questions, I'm going to put in a little plug here. If you're thinking ahead to your audit or you have questions for the audit team, we do have our first Audit 2020 webinar coming up. That's going to be on February 6th at 1 p.m. and information about that is on the audit training website. Thanks for letting me shamelessly plug, Mel.
Thanks, Randy. Next question is from Candy. She asked the previous questions about statins. She wanted to clarify the list she ran was in February 2019 was actually the list of TWD as of December 2018. I just want to make sure that I stay with the same list of people. Is that correct?
You know, Candy, I was just, when I answered your question before, I was thinking that maybe what she meant was that she set up her target group in February, And if that's the case, then yes, your data for the end of the year should be the same people as you set up that target group in February. So hopefully that clarifies it, and I apologize for any confusion.
Next question is from Chana. Our RKM was nutrition education for children ages 9 through 12. We overestimated the number of kids in our target audience because we estimate the number based on previous year's numbers. Is this going to be a problem? Is there some way we can change our baseline data? Yeah, well, I would suggest start by talking to your ADC about the changes you want to make, and they'll be the ones to I recommend to talk to, and if they approve your changes, you can make those changes in the SOS, or if you need any edits in the SOS, you can contact the SDPI team, which is sdpi@ihs.gov. Next question is from Nevada Urban. Look to run a final web audit for 2019 so that I can input that information into my program's annual progress report. Will I need to wait until February 1st for the web audit to reopen to run it, or am I missing something? Karen, would you be able to answer that one?
Yeah, so the annual diabetes audit, the one that's conducted and required for SDPI grantees every year, covers the previous calendar year. So the audit that we call 2020 will look at the care provided from January 1 to December 31 of 2019. And the tools for that are not yet available on the web audit, but they are coming very, very soon. So if you can wait till the next couple weeks, that'll be available to you to do your annual audit. If you need to run an audit for another reason, or you need to look at your data preliminarily, you can always conduct a 2019 interim audit. So that wouldn't be your official one, just be one that would let you look at whatever data you have as of now. So you could do an interim for 2019, or hang tight, and in a couple weeks you'd be able to do a 2020 annual audit or interim. Hope that helps.
Great, and I think we are caught up on questions. So like I said, I am going to stay on and just do a demonstration before we end today's webinar.